The Health Minister, Dr Zweli Mkhize, says people are ill-informed when it comes to how the testing of COVID-19 works. He says the surge in infections in the Western Cape is because early detection was not possible because some people may be asymptomatic.
The numbers of people that have increased in the Western Cape are people who have grown up, who have become positive, they're infected in clusters, in retail shops, in factories. Now, that is unfortunately what may happen now as we ease the lockdown in different parts of the country. But why did it happen? It means that if somebody was not detected early, because many people are asymptomatic, there were the services that were essential services, food processing, factories for medicine production, and so on. But when that happened, each one of the people who was infected went back to their townships and villages and suburbs and spread the infection there. That's why we are having this kind of explosion we are seeing in the Western Cape. Now, that does not mean that the rest of the country did not benefit from the lockdown. It just means that in this case, we need to then focus on a much more intensive approach, because now 65% of the infections are coming from Western Cape. It's got nothing to do with testing. We have checked that, and all the comments, some of the people are making comments, are ill-informed. The reality is that we've got more infections in the Western Cape, and that's what we must focus on, because it's already showing the trends in the Eastern Cape. The rest of the country will have the same thing if we don't manage to contain what's happening in the Western Cape.